The reason young adults are at such high risk of being uninsured is they lose coverage at two key transition points, both involving graduation. And the results are really consequential. I mean, a lot of young adults do have pre-existing conditions. They tend to be a healthier age group overall, obviously more healthy than older adults. But conditions like asthma, diabetes can make it really difficult for them to get affordable health insurance in the individual insurance market. And we also find that young adults who are uninsured have much higher rates of not getting needed care because of the cost, also having medical bill problems, not being able to pay their student loans. So this really, going without coverage really does put them at risk, financial risk. Young adults starting in September were able to come on to their parents' policies if their parents had an employer-based policy that included dependent coverage. Young adults of whether they're married, whether they're not financially dependent, whether they're living in a different state than not living at home, so all young adults up to the age of 26. The major provisions start in 2014, the expansion of Medicaid to 133% of poverty. That's $14,000 a year for an individual, about $29,000 for a family of four. So young adults, this is a huge improvement in the coverage of young adults. Young adults who lost their coverage when they turned 19 as children are going to be able to stay on Medicaid if their income, family income allows them to do that. So a major improvement in coverage. About 7 million young adults who are currently uninsured would be eligible for Medicaid under the new expansion. For young adults who are in families with slightly higher incomes, those earning between 133 and 133% of poverty and 400% of poverty, that's about $88,000 for a family of four, $44,000 for an individual. They will be eligible to purchase a private health plan through these new state health insurance exchanges with subsidized premiums and also cost-sharing subsidies to offset their out-of-pocket costs. Because of the loss of coverage at graduation, this law really is in many ways a graduation gift for young adults. So instead of graduating and losing their coverage, they're graduating, they'll have lots of different options for insurance coverage to protect them, protect their families from catastrophic medical costs.